Did you know that you can spot certain stroke warning signs even 1 month in advance? Imagine being able to spot these warning signals before they become full-blown strokes. The top 10 stroke warning signals that you should be aware of 1 month in advance are revealed in this video. Welcome to our channel, where we talk about health and wellness issues. Early stroke warning indicators will be a major topic of discussion today. Did you know that a month before a stroke occurs, there are warning indicators you can look out for? Let's review these warning signals in more detail so that you can spot them early and avoid having a stroke. 1. High blood pressure. High blood pressure is a major contributor to strokes, and it can have disastrous repercussions on the circulatory system and blood vessels. For the prevention of stroke, it is essential to understand the connection between hypertension and stroke and to take proactive measures to control blood pressure. One can drastically lower their chance of having a stroke connected to high blood pressure by leading a healthy lifestyle and obtaining medical advice when necessary. A major risk factor for stroke, high blood pressure can harm the blood arteries in the brain. Headaches, lightheadedness, and nosebleeds are a few of the more typical signs of high blood pressure. 2. Fatigue. Both a sign before and an after effect of stroke can be fatigue. For stroke survivors, recognizing and treating fatigue is essential since it can affect healing and general quality of life. Effective management frequently calls for a multifaceted strategy that includes medical care, rehabilitation, and consideration of one's mental well-being and sleeping habits. Stroke survivors should collaborate closely with medical professionals to create a personalized plan for dealing with fatigue and enhancing their well-being. An imminent stroke can typically be detected by fatigue. Lack of sleep, stress, and a bad diet are a few frequent causes of weariness. 3. Vision problems. Vision issues can both precede a stroke and be one of its after effects. Vision changes must be recognized since they may signal a medical emergency, especially if they happen rapidly. Seeking urgent medical help can save lives, since timely treatment can lessen the harm a stroke causes. Stroke survivors who have vision issues should collaborate with medical professionals to create a thorough rehabilitation and vision management plan in order to enhance their quality of life. Vision issues can signal a stroke because they show that the blood supply to the brain is being disrupted. Blurred vision, double vision, and loss of vision in one or both eyes are a few typical visual issues. 4. Sudden headaches. Particularly when they are accompanied by additional stroke warning signals like facial drooping, arm weakness, speech difficulty, or changes in vision, sudden and intense headaches can occasionally be an indication of a stroke. Even though not all headaches are a sign of a stroke, it's important to pay attention to them if they are very severe or come on abruptly without a known cause. When having a strong headache, especially if it is accompanied by other stroke symptoms, it is important to seek prompt medical assistance in order to start treatment as soon as possible and limit any potential brain damage. Keep in mind that time is of the essence when it comes to stroke, and immediate response can save lives. An approaching stroke may be indicated by sudden, intense headaches, especially if they are accompanied by other symptoms. The following are some typical headache triggers: tension, migraine, and sinusitis. 5. Numbness and weakness in limbs. A stroke can be detected by the onset of numbness and weakness in the limbs, especially if it happens rapidly on one side of the body. It should not be disregarded if it is present along with additional symptoms, including face drooping, trouble speaking, or excruciating headaches. For a prompt diagnosis and efficient treatment, it is critical to recognize these symptoms and seek quick medical help. Rapid action can significantly alter the course of a stroke, perhaps averting long-term disability and enhancing recovery prospects. Keep in mind that time is of the importance and that every minute counts in the event of a stroke. A stroke may be indicated by numbness or weakness in the face, arms, or legs, since it signals brain damage. Pinched nerves, arthritis, and carpal tunnel syndrome are a few typical reasons of numbness or paralysis. 6. Difficulty speaking. Slurred speech, the inability to construct cohesive phrases, or trouble interpreting language are all examples of speaking difficulties that can be a serious stroke warning sign. It's important to remember that this symptom should not be discounted, especially if it's present along with other symptoms like facial drooping, arm weakness, or visual issues. A prompt response to these symptoms is essential since it can help with a quicker diagnosis and the delivery of medicines that could save a person's life. Time is of the essence in suspected stroke cases, and receiving prompt medical care can significantly increase the likelihood of a good recovery and reduce long-term damage, Speaking with difficulty can signal an oncoming stroke, since it shows that the language center of the brain has been damaged. Stuttering, slurring, and difficulty finding words are a few common reasons why people have trouble speaking. 7. Memory problems. Stroke can cause memory issues, including trouble remembering recent events, amnesia, or cognitive difficulties, especially when it affects the parts of the brain that control memory and cognition. Even while memory issues can be caused by a number of illnesses, including stroke, it's important to recognize them as potential symptoms and get medical attention if they appear suddenly or in conjunction with other red flags like limb weakness, difficulty speaking, or visual abnormalities. Early diagnosis and treatment of stroke patients are essential since they can lessen cognitive impairments and enhance the overall quality of life for stroke survivors. Always remember that a better prognosis for stroke patients depends on prompt action. Memory issues can signal a stroke because they show a blockage in blood flow to the brain. Forgetting things, getting lost, and having trouble focusing are a few frequent memory issues. 8. Loss of balance. A stroke may be the cause of a sudden loss of balance or coordination, especially if it happens suddenly and for no apparent reason. It's important to pay attention to this symptom, especially when it's accompanied by other well-known red flags, including trouble speaking, limb numbness or weakness, or excruciating headaches. It is essential to get medical help right away if you have these symptoms in order to get a quick diagnosis and effective treatment. The likelihood of reducing the effects of a stroke, avoiding long-term disability, and boosting recovery prospects can all be considerably improved with early care. Keep in mind that time is of the essence in stroke situations and that quick action can save lives. A stroke warning symptom, loss of balance, is a sign of coordination center impairment in the brain. Inner ear issues, muscle weakness, and adverse drug reactions are a few typical causes of balance loss. 9. Nausea and vomiting. Even though they are not the most typical stroke symptoms, nausea and vomiting can occasionally happen, particularly in situations of severe stroke or when particular brain regions are impacted. These warnings shouldn't be disregarded, especially if they're coupled with other cautionary indicators like sudden weakness, difficulty speaking, or eyesight issues. It's critical to recognize the potential connection between nausea, vomiting, and stroke and to get help right away. Rapid action can result in an accurate diagnosis and prompt treatment, improving the likelihood of a better result and lowering the risk of long-term harm. Keep in mind that every second counts in stroke cases and that quick action can save lives. Since they signal an interruption in blood flow to the brain, nausea and vomiting may be an indication of an imminent stroke. Food poisoning, viral illnesses, and motion sickness are a few of the more typical causes of nausea and vomiting. 10. Chest pain. Typically, chest pain does not directly indicate a stroke. Instead, it is more frequently linked to heart-related illnesses like angina or heart attacks. However, since it may be a sign of a serious medical condition that has to be treated right once, chest pain should never be disregarded. It's critical to seek immediate medical attention while suffering chest pain in order to rule out heart issues or other potentially fatal diseases. When chest discomfort is accompanied by additional stroke symptoms, such as abrupt numbness, weakness, or difficulty speaking, it's critical to take a stroke into consideration and take immediate action. Both heart-related illnesses and stroke outcomes can significantly change with early care. Due to the disturbance of blood flow to the heart, chest pain may be an indication of a stroke. Heart attacks, angina, and acid reflux are a few typical reasons of chest pain. Currently, there is no scientific proof that suggests there are symptoms months before a stroke. However, a number of risk factors, including high blood pressure, smoking, diabetes, high cholesterol, and heart disease, might raise the chance that a stroke will occur. In order to lower your risk of having a stroke, it's crucial to control these risk factors and lead a healthy lifestyle. Additionally, it's crucial to get medical assistance right away if you or someone you know develops any sudden or severe symptoms, such as trouble speaking, abrupt numbness or weakness in the face, arms, or legs, or a severe headache, as these could be signals of a stroke.